my dental were done tax-free in actuality. So, which is good, you know.
So you're saying all right, you just taught me something. I didn't know this. So you're saying with your health savings account, you can, if you don't use it year in and year, it's obviously no taxes are taken out of it, right? But if you don't use it, whatever you put in there, they don't take anything away. It just keeps adding on and keeps adding on.
Correct.
And then you take that and you use it for your health care, specifically for your dental.
Dental. If I saw a doctor, I would use it because I don't have copays on my plane either. So if I had to see a doctor, I would use it for that. In my case, I use it for dental specifically because for the most part, that's my only real health care needs, to be personal.
Can you cash it out?
Most of the time.
Can you take it out and use it for your own personal, let's say 5 years in, you accrued about $30,000, you never needed to use it. Could you take it out and use it for anything personal, or is that only for health care?
Well, if you did, you have to pay tax on it and a penalty. So yes, you can access the money, but you didn't pay tax on it the first time, so then that becomes taxable income, and kind of like an IRA, they have a penalty for withdrawal type thing. It's almost like a medical IRA, if you can picture that. So, yes, you can, you know, but here's the other thing that people have done with these things. So, you know, like me personally, okay, I use that money for dental, so you know, every year. But what I could do, I could save that. I could not use it for dental and just save the receipt. You know, just save the receipt. And suddenly I have $20,000 worth of receipts. Now I'm gonna take the money out and buy a car. You know, because
wait, explain that. Say that again.
Let's say I just saved the receipts for medical care. Okay, let's say I never actually use my, you know, they give you like a debit card kind of thing to use it for. But let's just say hypothetically, I went to the dentist, I went to the doctor, and let's just say I had $20,000 over the course of 5 years or 10 years. Let's say I slowly accrued $20,000 worth of medical care, right? But I paid for all of it myself. I just kept the receipts, right? There's no time limit or no statute of limitations on when you submit these receipts to your HSA fund. So if I have $20,000 of medical receipts and I never took money out of my HSA for that, I can then turn in my $20,000 worth of receipts and pull that cash out and use it for anything I want because I have the receipts to back it up. So I could, in theory, over the course of time, and I don't use it that way, but people have, or so I've been told. People have done that where you can, you know, because all you have to do is keep, you know, I'm not organized enough to keep receipts that long. You know, keep receipts for 5 years, you know, keep a pile of receipts in case I want to buy something else. You know, that's not my world.
And what is the taxes? You said that they'll charge you tax if you just take it out randomly. What is the tax that they'll charge you? What's the percentage?
It's whatever tax bracket you're in, because you didn't pay tax on it the first time. So if you're in the 30% tax bracket, you're going to pay 30%. If you're in the 10% tax bracket, you're going to pay 10%.
Okay, excellent. All right, now, do you know any, are there any secrets that you may know? Like, is there any secrets that you'll tell, let's say, like, your family, as opposed to telling a potential customer or someone like me? Like, hashtag be honest, though. Like, seriously, is there any healthcare tips or secrets that you know and you may tell your family and your loved ones, but you will not tell anybody else?
I'm kind of an open book, so I mean, I don't have too many secrets because I'm always trying to help the client, trying to find the best deal, but my only secret is, and this is with health insurance, or go take the highest deductible that you can afford, because either you beat insurance or insurance, either you beat insurance or insurance beats you, meaning. You don't want to be overinsured. You certainly don't want to be underinsured, but you don't want to be, either your insurance company can control your money or you can control your money. And, personally, I want control of my money, not the insurance company. So just like my car insurance, I have the highest deductible I can swing on that. I mean, I have $1,000 deductible on my car insurance. I have $1,000, $1,200 deductible on my house. I'm trying to self-insure as much as I can because, play the odds. I mean, most of us don't crash our car for a living. Most of us don't go to the hospital for a living. I guess if you work at the hospital, you do, but I mean, from a medical side of things, most of us don't end up in the hospital for a living. Therefore, people once in a while worry about, I need a low deductible because I can't afford a higher deductible if something happens to me. Well, if you just don't, if you go with a higher deductible and don't change your lifestyle too much, you save that money more often than not. Just in saving the premium. So, self-insure as much as you can. If you have an HSA, then you build up your HSA fund over the course of time, and that's what you use through the medical care. And once you have, more than your deductible saved, I would keep funding the HSA, but then in actuality, you have no worries. You can even raise your deductible again, if you could.
Okay, you keep talking about deductibles.
It's different now because now with Obamacare, with the Affordable Care Act, you can't really choose your deductible like you used to. It used to be a pick your deductible, pick your plan. Now it's a little more of a cookie cutter thing, but it's a little bit different than it was.
So you keep talking about deductibles, and you mentioned earlier, I wanted to come back to it. You mentioned you have a deductible where everything, if you have the $6,000 deductible, I believe you said, and then
yes, everything
that you need to get done is they pay for it 100%?
After the $6,000.
Now, there's no limitations on that?
No. There's no limitations.
So, and that includes everything. Well, that includes everything.
Everything is medically necessary.
Well, what's medically necessary?
Well, if I decide I want to have a nose job because I don't like my nose, well, that's cosmetic. That's not medically necessary. Now,
okay.
Now, if I get in a car accident and I break my nose on the steering wheel, then that is medically necessary. But elective surgery is not medically necessary. So in that case, if I want to get a nose job and just because I want a different nose, well, then I got to pay for that myself, and my deductible is not relevant.
But most people don't have that, right?
No.
Because the reason why I'm asking is medical bills. Let's just address the elephant in the room, right? Medical bills is the leading reason for bankruptcies in our country. Is that correct?
That's correct. Yes.
Okay.
Now, I will add to that. I will add a little bit to that, though. Yes, it is, but typically there's some other debt going on there as well. Just the medical bills put them over the edge. But
okay, fine. Now, a lot of people, I know that I speak to, especially when I was working and I was getting insurance, I would just basically, like you were talking about earlier, I was the guy, I would look at the different plans available and I would just pick the cheapest one. I'll just go any, mini, miny, mo, catch a piggy by the tail, and I would pick, right? Whichever one I want. But a lot of people are under the impression, Eric, that once they pay their deductible, and this is for dental, for health, they believe that they have the same plan that you're talking about where it just pays 100% of the bill.
Right.
And I personally had a lady, one year, this lady contacted me and she needed to get, she had insurance. I was talking to her about her dental insurance. She was saying, no, I'm fine. I got, no matter what, my deductible is $1,500. Once I do that, everything else, they're going to pay 100%. I promise you, about 9 to 12 months later, Eric, this same lady called me back, and she needed to get about $20,000 worth of dental work done. And her insurance company was only going to pay $1,500 of it.
Well, and that is the problem with dental insurance, and that's why I said part of the reason why dental insurance is not a very good value most of the time, because most dental plans, the dental insurance has it figured out. I mean, most dental plans have a $1,500 cap, a $2,000 cap, a $1,000 cap, and if you need a crown, that might be $2,000. Well, and on major work, that's why I'm a big fan of the discount dental plans, by the way. And I know you're big into those things as well. But I'm a big fan of discount dental plans versus a traditional dental plan because, a good dental plan is going to cost you probably $35 a month. Okay. So but if you have a discount plan or you pay cash for, let's say like most people use your teeth cleaned twice a year and one X-ray. Well, you can with a discount plan or even a cash plan for that matter, you can probably get the cleanings done for around $70, maybe $100 each, and the X-ray once a year probably $35 or $40. So, you've gotten yourself clean for $250, but your premium, would be $400 plus a copay or plus whatever. And then if you need something major done, a crown or root canal, or in your client's case, $20,000, whatever it was, even a crown or a root canal might be $2,000. Most dental plans only pay 50% of the major things, up to the out-of-pocket maximum, which is, or up to the limit, which is only $1,000, so they're going to pay like $500 of a $2,000 crown. The math doesn't add up on traditional dental most of the time. So, the discount plans that are out there are great. The cash plans are out now. Like I said, in my case, I fund my HSA. So if the dental plan or the dental insurance did have a $2,000 cap, I would pull the money out of my HSA to pay for it, which is totally within my legal rights to do so. Of course, you have to fund the HSA. Not everybody's in a position to fund the biggest problem with HSAs, in my opinion, and I love them, is most people think it's a great idea to have an HSA. Most people don't actually take the time to actually fund the HSA, so then it's worthless.
Imagine having a licensed healthcare insurance producer in the family. Regardless of the complexity of your question, you are one phone call away from an accurate answer. Question about healthcare insurance policies? Question about healthcare insurance law? Contact my friend Eric Wilson over at www.isellhealth.com. Eric is a contributor to many news stations including Fox News and CBS. Contact Eric today. You'll be glad you did. Protecting your health, protecting your wealth.